we are going to talk about the Glasgow Coma scale. Right after I close the door. Okay, the Glasgow Coma scale is a mechanism by which you measure a person's eye opening, their verbal responses, and their motor responses to determine what type of hospital or what type of care center you need to transfer them to. So the thing about the Glasgow Coma scale is that even a rock has a GCS of 3. So when we talk about the Glasgow Coma scale, as I said, the scores are in 3 categories. The first one is eye opening. And then we have verbal responses. And then we have motor responses. Okay? So in eye opening, they either have, the scores go from 4 down to 1. And at the top, we have spontaneous. So they're opening and closing their eyes without any direction from you or anything like that. That gives them 4 points. If they open their eyes to verbal commands, that gives them 3 points. Okay? If they open their eyes to painful stimuli, that gives them 2 points. And if they don't open their eyes at all, they get 1 point. Okay? The lowest possible score on the GCS is 0, the highest possible score is 15. When we come to verbal responses, at the top of verbal responses, this is a 5-point scale. So we go 4, 5, 6. So at the top of verbal responses, we have oriented. In 4 points, we have confused. In 3 points, we have inappropriate. So you can understand what they're saying, but the words they're using are not appropriate for the situation. What color is the sky? If you ask them that and they say, my dog is green, you know that there's something a little bit wrong there. The number 2 in this measuring schematic is incomprehensible. That means they're groaning, they're not making any intelligible noises at all. And the number 1, again, is none. So the bottom of each of these is always going to be none. So we've got 4 points here, maximum of 4 points here, maximum of 5 points here, and then we come to our motor responses. So at the top of our motor responses, we have 6 points, 5, 4, 3, 2, 1. And at the top of 6, we have obeys. That means that if you ask them to do something, they can do it. Can you squeeze my hands? Yes, so they do. Then we have localizes. So they localize their pain to whatever area it is that the pain happens in. So if they obey you, wonderful. If they say, I'm sorry, I can't move my arm because it hurts too bad, that's localization. If they withdraw, if you provide a painful stimuli and they kind of draw back from you, that's going to give them 4 points. Okay, and then we have decerebrate and decorticate posturing. So we have abnormal flexion, abnormal extension, and then none. I gotta look at my book, sorry. Just gotta make sure I'm not lying to you. I've been known to do that occasionally, particularly when there's no one here to keep track of me. right. And I had it right anyway. I just needed to make sure. Okay, so we've got abnormal flexion, abnormal extension, and then none. Okay, so if you are assessing a person and their eyes open spontaneously, they're oriented to conversation, and they can obey your commands, their GCS is 15. If you're assessing a person and they fall anywhere else in here, then you have to figure out what their GCS is. And GCS is important because depending on where they land in the GCS scale, it may change where you are going to take your patient. Here, we're going to take our patients to St. Al's if we can. If you are out in the field somewhere and the closest hospital is not St. Al's, then follow your local protocols.